I do not expect all of you to be here tonight. I am going to make it a little shorter just because I think people are so focused on their exam that we're just starting respiratory anatomy and physiology. We do actually have 2 labs for this. What I mean by that is I mean that we start into it tonight. We'll finish it up next week. All your stuff that's due for lab for respiratory anatomy and physiology is not due till the 18th. So you've got time, okay? That's what I want to make sure I emphasize. You have time. It's not something you have to focus on that quickly this week. You've got another week to complete that. However, when I say this, I know I want you guys to put your focus towards completing your exam this week. That should be your focus, okay? That's one of the main things I'm concerned with. I don't want to jump into a bunch of respiratory anatomy and physiology tonight just because I don't want you guys to be focused on something new when I really want you to jump in and take your exam as opposed to focusing on respiratory system when you've got a whole nother week that you can finish that information up, okay? All right, with that said, all right, so with that said, if you come up to the schedule, it says fall 2020, this is under getting started, fall 2020 anatomy physiology online schedule. Come down, we are at week 7, okay? Just as a reminder, we are at week 7. So week 7, it says we're starting anatomy, physiology of the respiratory system, jumps into week 8. This also lists that the exam became open yesterday through Saturday, labs 1 through 5. I know you guys are already aware of all this. I'm just pointing it out, okay? All right, we'll go back because now we're going to jump into what would you guys be expected of for respiratory system and what do you want to do as soon as you complete your exam. I would love for you guys to jump into the respiratory system to some degree. And what I mean by that, I do not want you to complete everything. You don't need to complete everything. We're not going to go over everything tonight. So keep that in mind. Okay. So when we jump into respiratory system, we're on chapter 22. And I'm going to pull up here. Okay, can you guys see my screen? I've moved around. Can you see it still? Can you guys see my screen? Can you see lab 6 respiratory system? So let me know if you cannot see this. So objectives, what I want you guys to be responsible for. Here's the objectives. There is a ton under objectives. However, it's not difficult stuff. It's just, I would jump into it as soon as you finish your exam because there is quite a bit that we need to go over, okay? And I won't have all the time next week to go over all this. So describing the role of the respiratory system, the overall role of getting the oxygen into the blood, to the cells, to the tissues, getting carbon dioxide out of as a byproduct released, right, from the lungs. We'll talk about that in more detail. And then I want you guys to be able to look at certain terms. You have to know certain terms. They're on the handout, like pulmonary ventilation, external respiration. What does that mean? Transport respiratory gases and internal respiration of the tissues and blood gas exchange. Then describe pleural coverings, the pleura that covers the lungs. So you guys talked about serous membranes. We talked about that in MP1. This is the same thing. We just talked about it with the heart too. So this is going to be for the respiratory system. Okay. And the next one is describe mechanics of pulmonary ventilation. So what does that mean? We'll go over that in the handout also. And then define respiratory volumes and capacities. Okay. And then the next thing is demonstrate spirometry, which is, we're going to talk about this next week, this last couple of things, these objectives. Describe techniques for auscultating, listening to the respiratory sounds, and then respiratory system acid-base balance of the blood. So the blood pH, how do we balance the pH of the blood? That's going to be the last thing. We'll talk about that next week. All right, those are a little bit more involved, so we'll spend some time on those. But for tonight, I want you guys to be able to see that there are several things you're supposed to look up on Connect using Anatomy Physiology Revealed. There are several animations that are really good. I think you guys will enjoy going over the respiratory system as you see these. So let me move down. Ooh, okay, I'm scrolling. Hold on. So those are things I want you just to be able to look up. There are some videos. Move down in the dissection tool. These are the things you need to be able to identify in the dissection tool, okay? So it goes through everything from, hold on, everything from your external nares to all the way down to the lungs and the tissue. Hold on, I'm turning somebody's off real quick. Okay. All right, hold on. Mute. Okay. I don't know if it did or not. Okay, so the next thing I want to point out is as you scroll through these with the Anatomy Physiology Revealed and you go through them, compare them to what I have. Like I've got the document with the pictures. And then also, obviously in your textbook, you're going to have all these images. These are very straightforward images. They're not complicated to look at. I've got some of these we're going to look at together. We're going to discuss them, okay? And then next thing is, here is just a look at the different aspects of the larynx and the pharynx, trachea, and the bronchi. So you guys will go through this. These are specific things that have to do, or I should say, have to do with the larynx, but are also around the upper respiratory locations, okay? They're very specific. We'll talk about those tonight too. And then in the anterior view, these are the different types of cartilage and majority wise. And then we've got the trachea, which we're going to talk about the trachea, what it looks like overall, and then the tracheal cartilage that's found throughout, which is listed here. So we'll talk about all these. These are just another way to view them, but you do know if they're listed, you need to identify them. Posterior view of all of these. This allows you to look at it from all angles, which is super smart. And then in the lower respiratory, the membranes. So parietal pleura and visceral pleura, that has to do with the serous membranes. That's something that we have, like I said, we talked about in AMP1. Here it is again. We talked about, these serous membranes wrapped around in, specific areas. You guys talked about the pericardium. That was the serous membrane around the heart. The pleura is going to be the serous membrane around the lungs. Okay, so we're going to spend some time on that also. Then, let me move this over. Then we're going to talk about, or you guys are going to look up the respiratory tract. We're going to talk about these, obviously this too. Go down to basically the whole flow from upper respiratory system and all the way down. So if you go from like air goes and enters the external nares, and then it goes through and touches these certain structures as it runs through all the way down into the lungs. So it's going to take you from upper to lower. These are all the identifications you need to be able to look at, be able to identify them on Anatomy Physiology Revealed, and then we're going to talk about them off the images. Okay, so if you come down, I want to show you this too. Oh, I passed it. Hold on. All of this that is listed, although you're going to look it up on Anatomy Physiology Revealed, you're going to look at all of these things. There is a video on respiratory system anatomy review. Hold on, guys. I'm going to open this door. The Anatomy Physiology Respiratory Review. This is a video that one of our instructors did. It is really good. Watch this video. She goes through all the structures that are actually listed here. I would love for you guys to take the time, please watch that, and then I would re-watch that, okay? She does a really good job going through all the structures that are listed here. So make sure that you look at this, pull it up on Anatomy Physiology Revealed, and then watch the video. You should be able to identify all of these structures, and all of these structures are identified within this video also. So that's something that's kind of a easy give me at the same time, but it's still like, it's such a good video. She did a good job. So just look at that, make sure you're able to go through every single one of those structures. All right, now what I want us to do, okay, now that we've gone over the objectives and we've looked at everything that's listed here, I want us to first, I'm going to point out what you're expected to do. Let me just show you this next week, and then we'll jump into the handout. Come down here. Okay, pass up the handout. We'll come back to that. So there's pulmonary function test. I want you guys to look at or do this on Connect. Look at that at least by next week. And then mechanisms of breathing, I want you to be able to do that next week. This is not something that needs to be done this week. It's something that's done next week. It's not due until the 18th. Okay, we'll come back. All right. Here is the handout. This is Dr. Mobley's handout. We're going to go over it together. And then I've got some images I want to pull up and show you as we talk about this. So what is the role of the respiratory system? And you guys know that you can talk. I'm going to unmute some people. You guys can either talk or type in some messages as we go through this. So what is the role of the respiratory system? So the major function is, of course, to supply oxygen to the tissues, to the cells, and get rid of carbon dioxide, and then basically take it back to the lungs to expel it. Okay, so we're taking in oxygen via the lungs and we're expelling carbon dioxide via the lungs, right? But the whole purpose of this is taking in that oxygen, pumping it, right, via the circulatory system, and then it sends it to via diffusion, right, in these little capillary beds to the tissues that it needs to supply. Once it has supplied those tissues, the mitochondria has used that, all that up, they use the energy, then as a byproduct, you are releasing carbon dioxide. That carbon dioxide is now being diffused back up venules, then to the veins, then pumped back into your respiratory system to be released, and then you've getting rid of carbon dioxide, you're pumping in more oxygen, okay? So we're going to talk about how does this work. So we need the oxygen to supply the cells, and we need to get rid of the carbon dioxide because it's going to be a byproduct, okay, metabolism. So the major function is supply oxygen and get rid of carbon dioxide, the byproduct. All right, so we want to fulfill respiratory system functions. We have 4 distinct ways we do this, okay, and hence you do need to know these terms. So number 1, or A, is pulmonary ventilation. That's just breathing, ventilation, breathing, okay? So movement of air and out and in and out of the lungs, okay? So alveoli are exchanging back and forth via diffusion. There's the gas exchange that happens, the oxygen, the carbon dioxide happens at a very thin layer of squamous cells, which we'll look at, and we'll look at these structures, all right? This is pulmonary ventilation. So just the act of breathing, okay? Inhalation, take in, and then exhalation, push out, okay? The external respiration is going to be the term that you need to know for oxygen loading, carbon dioxide unloading, okay? So that's going to be the gas exchange where the blood is going to exchange with gas via the lungs, the alveoli. So it's going to be the external respiration, not internal, but external, because it's interacting with the external environment, okay, for the gas exchange to happen with the lungs and the blood, okay? The next term is transport of respiratory gases. That is when blood is the transport vehicle. So it's taking the oxygen via the circulatory system, via the blood, attached to the hemoglobin, passed on down to where the tissues, right, are going to be supplied with the oxygen, and then it transports carbon dioxide back via the circulatory system to the lungs to release that carbon dioxide. The internal respiration is the opposite, or I should say the other end of things from the external respiration. Internal respiration is the oxygen unloading. Instead of taking in oxygen, okay, in the lungs, now we're unloading that oxygen to the tissues, and we're taking up carbon dioxide from those tissues, from that byproduct, into the blood. It now attaches to the hemoglobin and sends back to the lungs and to be released, okay? So those are the gas exchanges, hence how it's written, blood and tissues via the cardiovascular system. All right. Now, respiratory system excludes A and B of that list. Okay, that makes sense, all right? Of course, if the cardiovascular system was to fail with the respiratory system, an organism would not survive, okay? All right, now, what about trace of flow of air from the nose, from the nostrils to the lungs, right? And from the lungs to the nose? How does that work? So we've written down the flow. So at first you take in air via the nostrils, you have the nasal vestibule, okay, that comes in and divides, and then you've got the nasal cavity or nasal concha and meatus. We're gonna look at these in just a second. You have the superior, middle, and inferior, okay, concha and meatus. And then it goes into the throat region, which you guys are going to think of as throat region. We're going to look at this in a second. Into what we call the pharynx. The pharynx behind the nose is called the nasopharynx. The pharynx behind the oral cavity is called the oropharynx. And the pharynx behind the larynx is called the laryngopharynx. So then as we pass through these structures, because the nasal cavity comes first, then the oropharynx or the oral cavity comes next, and then the larynx comes on down as the third structure we're going to pass through. So if we go through to the trachea, we're going to go down past the larynx, okay? And do you guys remember what the larynx does? I'm hoping I want you guys to be able to type in or do something to respond with me. What is the larynx? What's a general term for the larynx?
Windpipe?
Yeah, well, it's the windpipe or like your voice box, right? The term people like to use is voice box, okay? So the larynx is at the very top of the trachea. As it moves down, okay, past the larynx, it goes down into the trachea, into the lungs. So the lungs, before it actually divides into what we consider the lungs, the trachea is going to create primary bronchi or branches, okay? These bronchi, which I'm going to show you a picture of in a second, they break off from a primary to a secondary where they make a bend. And then there's another bend that creates a tertiary bronchi or segmental bronchi. And then as they create smaller bronchi, they turn into bronchioles. And then as the bronchioles get even smaller, they turn into terminal bronchioles. Eventually, they turn into respiratory bronchioles because respiratory, hence the respiratory zone where oxygen and carbon dioxide is going to exchange. So that gas exchange is just going to happen there. So the respiratory bronchioles are going to have these alveolar ducts, and the alveolar ducts have alveolar sacs. What makes up the alveolar sacs, like these big grape sacs, are called alveoli. Alveoli are where the gas exchange happens. Now, let me change over and show you an image, and we're going to talk about why are the alveoli so important? What are the main function of the alveoli? Why are they big round structures that are in big grape sacs? What's the purpose of that? So I'm going to change over real quick, and I'll have to share your screen again, so just bear with me. Takes me a second. Okay. Hold on, I'll come back up here. Let's see. Okay. Okay. You guys should be on a handout. Let me know if you see a handout.
Mm-hmm.
Okay, great. All right, so from up here, this is representation of the hyoid bone, this little picture. This is your thyroid cartilage. We're going to get to that. These are identification items that you need to know. And then, of course, here's the trachea. Tracheal cartilage is what the little white ring-like structures are, okay? And as you go down, the trachea is going to branch off into the primary. You see the primary? These are the primary bronchi. Remember, bronchi, the I means plural, just like we've talked about other things in anatomy. They end with an I, meaning there's plural terms, right? If it's US, bronchus, then you know we're talking about singular, okay? And I believe that that's on your video too. So this is the right primary bronchus. This is the left primary bronchus. Remember anatomical position. So here's the right primary bronchus, and then when it branches off again, here's a secondary. And let's see if there was a bend here, this would be the secondary. And then these are tertiary bronchi, or bronchus for singular. So here, that's the right. This is the left primary bronchi. This is the secondary. I see a bend. And this is tertiary bronchi or bronchus. And then here creates the little bronchioles, okay? When we talk about the alveoli, we're talking about those big stacks, basically, of alveoli. We're looking at this tissue and magnifying it, okay? So we're looking at this in magnification, and we're seeing how these little bronchioles turn into these respiratory bronchioles. They get really, really small, okay? And you've got these little cartilaginous rings, these little tracheal rings, and they go, you can see and follow them through the primary, secondary, tertiary, and then as the bronchioles get smaller and smaller, they mainly turn into smooth muscle, okay? What would be the purpose if we had cartilage, these cartilaginous rings that go through from the trachea to the different bronchioles, and as they get smaller, it turns into smooth muscle? What would be the purpose of that? Why would you want the smaller you get in the lungs to be smooth muscle as opposed to cartilage? What do you think that purpose is?
For the lungs to be able to contract and expand?
Yeah, I think you're falling right on to what I'm trying to say. That was a good way of saying it, but contraction, not exactly, but I think you're trying to say exactly what I'm going to say. So it's resistance. So technically, when you've got the smooth muscle, it's a muscle. So if you have, for example, a lot of air comes in, you're taking a lot of air, say you're running, for example, and a lot of air comes in and you need to constrict because it's too much on the alveoli, the smooth muscle can squeeze, okay, automatically, okay, and they can constrict how much air gets in there, okay? You don't want to overflood because the tissue is very delicate. So the smooth muscle is going to allow for that to happen, that constriction. So it's going to control, okay, autonomically, you've got this control over it, right? And it's going to control how much is going to come in and how fast is it going to come in. That makes sense, right? Mm-hmm. But the rings, the cartilaginous rings, play another function. Why do you think we need these rings, cartilaginous rings? What function are they playing? So why would you need cartilage through your trachea and your primary, secondary, and tertiary bronchi, especially? What purpose is that?
For support.
Yeah, you said support. That's a good way of saying it, okay? So if we had it made of smooth muscle, then it would collapse, correct? If it collapsed, then there would be, one, hard for you to get air in. It may constrict, may restrict, right? Correct? But then if it's cartilaginous rings and it's not continuous, then there allows for a little bit of movement, because you see there's a little bit of tissue, okay, in between. But if you have something, for example, you take an air, well, it can expand to some degree, but the cartilaginous rings keep it open. You wouldn't want it to be smooth muscle. If it was smooth muscle, then obviously it would just kind of collapse and just be there, right? You don't know. You don't know how well it's going to work, or it could constrict anything that comes in, right? So you don't want it to over constrict. You want it to be open, accessible, but at the same time, you want it to be somewhat movable. So you've got cartilaginous rings spaced throughout. It's not a continuous thing, okay? And then smooth muscle at the very end. All right, so now we're going to take a look. As we talked about the flow, but I need to show you a different image so we can actually spend time on that. All right. Okay. So this image is showing you a sagittal view of coming in from the nose. This is going to be everything that we're going to see as we flow down to get to the lungs before we get to the trachea, for example. So here we go. Here's the nose. These are the nares. Okay, we call this the external nares when it's the outside of the nose. Okay, so now we've gone up in the nasal cavity. Now that we're in the nasal cavity, we see these weird structures here. Okay, you guys have actually seen this before. So there is these, basically, they're protuberance. Okay, they jet out in three different positions. Let's put it that way. There's a superior, there's a middle, and there's an inferior. We call these conchae. Okay, the conchae are protruding out in the nasal cavity. There are three, and then they indent in called the meatus. All right, so there's superior, there's a middle, and inferior, and then you've also got a superior meatus, middle, and then inferior. What would be the purpose? Why would I want to have these bulges in my nasal cavity? Why would I need three bulges? Why would I need it to be like this weird, irregularly shaped structure inside? What purpose would that play? If you were just thinking like, okay, I'm taking in air into my nose and there's this irregular surface found in the nasal cavity, what role do you think that would play if you had to guess?
If it's just smooth, it could collapse.
Well, here's the thing. If it's smooth, then air comes in and it rushes in like a tunnel very quickly, correct? So that could be a problem. I don't want one to quickly provide oxygen, or excuse me, air, let's just say generally air. I don't want to throw in air into my lungs and do it very quickly. But what I want to do is I want to create turbulence, okay? Just like if you take a boat and you've got a smooth sea and you can take it and just glide across the water. Well, you can get there too quickly, right? As opposed to if I have waves and it takes me time to get there, it gives me time to do certain things, okay? So that makes sense. Well, then think about this. What if you just took in air, say you're running outside, say it's the temperature that it is right now, it's 40-something degrees outside in the morning, okay? And you're running, okay? What do you notice, especially on a cold, cold day, maybe 40 degrees or less, okay? What do you notice if you're running outside? What's difficult when you take a deep breath? What do you feel?
If it's that cold, it hurts.
Do you notice? Yeah, it hurts. It's a shock to your lungs, right? So can you imagine if you took in that air and you took it in and it didn't have time to like break? There was no turbulence. Can you imagine if it was just a straight shot through your nasal cavity all the way down to your lungs? That would hurt. Don't you think that would kind of be a little overwhelming, especially if it's cold outside? So what's happening is the concha and the meatus, that the little indentations and the protrusions that you have in your nasal cavity, what they are doing is they're creating turbulence to slow down the pathway of air getting to your lungs, okay? What do you think that slowdown is important for? Why would you want to slow down air? We talked about shock, but what do you think it would be doing? Because we talked about running on a cold day, right?
Has time to warm it up a little bit?
Yeah. One, we can warm it up. Two, you're in a mucous membrane, so it's moist, right? We can warm and moisten up the air, okay? So if we warm and moisten it up, then it's not like you're providing dry air or too cold of air, okay? So now it's come into your nasal cavity and you come down to the back. Now this is what we consider kind of like that throat area, correct? So if you come from the back end, you go through the nasal cavity, here comes the air, now it's coming in, it's hit the back region of the nasal cavity. We call that the nasopharynx, okay? So naso meaning the nasal area and then pharynx meaning the throat region here. So that's the nasopharynx. That is literally this little section through here. It's labeled on this picture, but it's in this zone. I've got another picture of it too. Now, as we move down, you will notice that you end up behind the oral cavity. As you end up behind the oral cavity, we are now in the oropharynx region. So we're still in the throat, we're just behind the oral cavity. So the oropharynx region is a very short region through here. As we drop down, we get down here, and here's where the larynx is. As it opens up, where it can go into the trachea, because here's the trachea, here's the esophagus here. This becomes the laryngopharynx region, okay? Because it is the larynx region behind, or in the pharynx, behind the larynx, I should say. So we call it the laryngopharynx region, okay? And then as we drop down, so here's your larynx. We have the false vocal cords up here. We have the real vocal cords, or this is called vestibular fold also. You'll see it listed as the vestibular fold. The bottom one are the true vocal cords, are just listed as vocal cords. And then the middle is called the glottis, okay? So this is your voice box. And as you go down past the voice box, you're now in the trachea, okay? So if you go back up to this image, you will see here's the trachea. So that's what I'm looking at in a cross section or a sagittal view. So here's the trachea, there's the sagittal view, and now you're going to branch off as you go down into the primary bronchi, secondary, tertiary, into finally this small little bronchioles, into the respiratory bronchioles, the alveolar sacs, and then the alveoli themselves. Okay, so now let's look at another image. Okay, now you can see this. Here is the nasopharynx, here's the oropharynx, and here's the laryngopharynx. And this shows you the trachea and the esophagus. That's just a pretty good image just to highlight it so you can see the zones. That's really the only reason I posted that for you. Simple image you can look at, you get the idea. Okay, now come on down. I'm going to pass the image and come back to it. We'll come back to that too. Okay. So here we are. You'll need to label thyroid cartilage. We're not going to spend a bunch of time on that, especially tonight. We have next week to talk more about this. But thyroid cartilage, you'll need to know the cricoid cartilage, tracheal cartilage, and then here we go, the primary bronchi, secondary, and then of course tertiary, the little small bronchioles, and then now you're in the alveoli of each one of these little balls that create the grape sacs, okay? You just can't see them from afar. Now, one thing I want you to notice from a large image is that if you looked at the left lung and the right lung, they look different, don't they? So what's different about the left lung as opposed to the right lung?
The right one is a little bit of purple.
Okay, but what's it trying to show? So it's giving you different colors because there's different number of lobes. So the left lung has 2 lobes, hence pink and then blue. Okay, and then this is like a little cut through. We call this the oblique fissure. This is the left. It also has an indentation because your heart's going to sit here. This is called the cardiac notch. On the right side, there are 3 lobes, okay? Here is the superior, okay, right lobe. This is called the middle lobe when it's in the middle. So this is the middle right lobe, and then here is the inferior right lobe, okay? This over here is going to be the left superior lobe and the left inferior lobe. Okay, so this side has 2 lobes, the left side, the right side has 3 lobes, and then in the left side there is a cardiac notch, hence the heart it sits on the left side, okay, of your thoracic cavity. Now, I'm going to show you another image. I know I'm like overdoing you guys on images, but that's okay. Here's the trachea. This is showing you bronchus, as the turns down into the bronchioles, it gets smaller and smaller like we discussed. So this is a bronchiole. Here it comes down. It creates the ball-like structures at the end that look like grapes. Those are the alveoli. Okay, alveolus would be 1. Alveoli is going to be plural, just like we just talked about the bronchi and bronchus. And what do you notice about these little grape-like structures? Something's wrapped around it. What do you think that might be? So what exchanges at the alveoli that we talked about?
Oxygen.
Yeah, so but what do you think has to be there for oxygen and carbon dioxide to go back and forth?
Blood.
Blood, exactly. So what's wrapping around each one of these alveolus is these little capillary beds. So it's got two things, capillary beds, and then sometimes you'll see representations of these strands of elastic tissue because the alveolus has some elasticity to it. Hence the fact that just like the smooth muscle, it comes down, we create a lot of smooth muscle here, and now we have elastic tissue so we can expand and then we can recoil, okay? Hence the overall function of the lungs to expand and recoil. All right. Now, I'm going to hop off of this. I have to unshare you and reshare you, so just bear with me. Okay. I have to remember to do this every time. It's fun. Okay. Okay, can you guys see the handout now? Okay, someone just tell me, can you see the handout?
Yeah.
Okay, perfect, yes. All right, so where we got, I'm going to read this. All right, where we got to, trace the flow of air from nose to the lungs to the nose. So we went from the nostrils, the nasal vestibule, nasal cavity, nasal concha, meatuses. Okay, let me move you guys real quick. Superior, we had middle, we had inferior, both of the concha and the meatuses. And then we ended up in the pharynx, okay, the throat. We were in the nasopharynx, oropharynx, and laryngopharynx. Now we see the larynx. The larynx is the start, okay, as we start into the trachea. And then as we go into the trachea, we have the main primary bronchi, secondary or lower bronchi, tertiary segmental bronchi into the bronchioles, terminal bronchioles, respiratory bronchioles, where it starts to create the alveolar sacs, right? Here's the alveolar sacs. Alveolar sacs are going to be made up of alveoli, the little grapes, okay? Alveoli meaning plural, alveolus meaning one, okay? And as we move through, let's talk about the lungs and the covering of the lungs, because this is a serous membrane, right, that covers the lungs. I have a picture of this on down with the handout, so I'll show you that in just a second. So each lung is enclosed by a double layered serous membrane called the pleural membranes, right? So you guys remember this, hopefully you remember this. The outer layer is called the parietal pleura, attached to the thoracic wall and the diaphragm. The inner layer is called the visceral pleura, covers the lung tissue itself. So it's form-fitting as it's listed there. Just like I told you guys, if you took a balloon and you stuck your fist into the balloon, the visceral layer would touch the organ, which would be your fist, and then the parietal layer would be what would be the outside of the balloon that wraps around, and the in-between would be where the serous fluid would be, right? So if you took your fist into the balloon and you pushed it back and forth, it would be like the expansion and recoil of the lungs, just like the contraction and, you know, of the heart, for example. But that gives you an example of just the lungs for the visceral and the parietal. So how does that even work, right? So just like we said, the parietal is going to attach the thoracic wall and the diaphragm. The visceral is going to touch the actual lung tissue. Okay, so they're going to be interconnected to one another. In between is going to be the serous fluid. Why was serous fluid important? What role did serous fluid play?
Lubrication, basically.
Yeah, it was lubrication. So lubrication, it eliminates friction. Friction creates pain. Your heart's able to beat, right? We don't have any pain with it. Your lungs are able to expand and recoil. We don't have any pain with it. So that's the lubrication, the serous fluid, all right? And of course, we've got the two layers, they are connected. So also there's also the theory of a serous membrane holds the organ into a certain zone, for example. So if you got an infection, for example, it would stay in that area or that zone. Okay, that's another theory with the serous membranes. All right, let me go down. This is something we're going to come. No, hold on. No, we're going to go over this. We're going to go skip a couple of things, but this we're going to go over tonight. Okay, so when we talk about the lungs and how they work, we talk about pressure changes, for example. Okay, this is something that's listed in your book called Boyle's Law. It states that volume of the gas is inversely related to pressure. Okay, so what does that mean? So let's talk about it. So we know that pulmonary ventilation or breathing, okay, back and forth the breathing, the inspiration, the expiration, does two different things. But how does it relate to volume and then gas via the pressure? Okay, so what happens here? So the diaphragm contracts, okay, but when I say that it contracts, it flattens. So what is the diaphragm? How is it normally shaped when it's relaxed?
It's in like a U shape almost.
What is it?
It's almost like a U shape, like upside down.
Yeah, it's like a U shape. So the diaphragm is pumped up when it's relaxed, okay? So it creates like a U shape, like an upside down U, right? What happens is when it contracts, it pulls down. But when it contracts and pulls down, what does it allow for the lungs to do?
Expand.
Yeah, it expands down inferiorly. Then you've got the external intercostals. So those muscles, those external intercostals are going to contract. They are going to lift the rib cage, and it's going to increase the size of the thoracic cavity. Now, what have you done to the lungs? The lungs are able to open up, right? Anterior, posterior, lateral. So as they open up, what's going to happen via the pressure change? So the pressure from the outside air as opposed to the lungs, how are they going to differ?
There will be more pressure outside and it will go inside.
Correct. You got it. So the pressure outside is going to be greater as opposed to the lungs. Now that you've created this open volume space, everything's going to create more. If it creates more volume, the particles, right, these little molecules are sitting inside, and now they don't have anything to fill up, right? So the air on the outside is going to go towards the inside the lungs, okay? So like it says, lungs expand due to sticking to the thoracic walls, so volume within the lungs increases. Now, expansion of the lungs means the intrapulmonary pressure decreases, alveolar pressure, okay? So the air moves along the pressure gradient, down the pressure gradient, just like diffusion we talked about, and from the atmosphere into the lungs. Now, air moves from high pressure to low pressure, the alveoli, okay, to equalize, all right, just like diffusion. We talked about diffusion in AMP1. So inhalation occurs because the alveolar pressure falls below atmospheric pressure. Okay, now what about expiration? So if air is forced out of the lungs, how does it do so? So let's talk about that. So now we've opened up the lungs, we brought in all of this air, okay? So you had to contract, for example, the diaphragm, contract the external intercostal muscles to open up everything. Now it's going to relax. So exhalation occurs when alveolar pressure is going to be higher than atmospheric pressure, okay? So it's already brought all this stuff in. Relaxation of the diaphragm, the external intercostal muscles result, okay, in elastic recoil of the chest wall, increases alveolar pressure now because the space has gotten smaller. So the air moves from the lungs, now higher pressure, to the atmospheric pressure, which is now lower pressure, okay? So it's not a, let's say, very involved contraction of muscles to push it out like you have to do, oh, you know, if you contract your stomach and try to pull, you know, your diaphragm or whatever, but that's not what's happening. If you try to do that and push your diaphragm up even further, maybe you'll push it out a little bit more, but it's really a relaxation state, okay? That's the difference. And so the air is going to go outside as opposed to, now the pressure's higher inside as opposed to outside. Now it's going to flow to the outside. So you're not having to contract any muscles. You're actually relaxing and the air is flowing out. Okay. Now, with that said, let's look at this image, because here is a picture of the lungs and here's thoracic cavity. And then we talked about visceral pleura and parietal pleura. The visceral pleura is going to be wrapped around the lung tissue itself, actually touching lung tissue. The parietal pleura is going to touch the thoracic cavity and the diaphragm down here. And then you can see that there's some partial pressure gradients here, okay? For example, let's give me an example of what the intrapulmonary pressure, 760, intrapulmonary pressure, or excuse me, intrapleural pressure, okay, about 4 millimeters of mercury different, and then the transpulmonary pressure, 760, equals about 4, right? So that's just to show you an example where the spaces where these pressures are created, for example, so you can look at that and see a little bit of how that works. It just gives you an idea, okay? Now, let's talk about respiratory volumes and capacities. So everybody knows everybody's different. Their sex, age, their size, all of that's different, okay? Our genetic makeup, how we're made up. We may be able to have bigger lung expansion. We may be, you know, just everything's different depending on who you are, right? But when we talk about respiratory volumes and capacities, the normal quiet breathing volume is typically around 500 milliliters of air that comes in and out of the lungs. And we call this tidal volume. When we're just normally breathing, we're not pushing, we're not, you know, trying to push back and forth or expand your lungs or anything like that. We call this the tidal volume, when we're just normal breathing. When we're normal breathing, we push back and forth about 500 milliliters of air, okay? It's the amount of air inhaled or exhaled under the breath under resting conditions, right? Then when we talk about the inspiratory respiratory volume, that's going to be the amount that we force after the tidal volume. So I'm going to try to inspire more, for example, as opposed to in addition to what my normal tidal volume breathing would be. Normal than what the 500 is. The expiratory respiratory volume is going to be the amount of air that you can force or exhale out beyond the normal tidal volume. Okay, normal being the 500, right? So notice I can inspire 3,100 milliliters more in addition to that 500, okay? I can expire 1,200 milliliters in addition to the 500, for example. So why do you think you can take in more and can't, as opposed to pushing out less? Why can you take in more as opposed to pushing out less? Why would you be able to do that? What did we talk about with the lungs? Like contraction wise, you can open up to get more, but if you're pushing out, the recoil is all relaxation, right? So it's going to be harder for you to push out more as opposed to taking in more, correct? Because this involves muscles that you have more control over, and this is relaxation, okay? All right, and then residual volume, the amount remaining after you've got the forced exhalation, is around 1,200. And then we look at vital capacity. That's the maximum amount. If you take your tidal volume, your inspiratory like reserve volume, expiratory reserve volume, that's all of that together. So that means if you take in big breath of air and then you push it all the way out, that's going to be your vital capacity. What can you push out totally? 4,800 milliliters approximately, okay? And there is a little diagram here. Here's the diagram. It shows you here's tidal volume, here's inspiratory reserve volume, here's expiratory reserve volume, okay? And then vital capacity shows this is the residual, what's just left, okay, that we can't get out, the 1,200. And then functional residual capacity, it just shows you, okay, divides them up. Total lung capacity is around 6,000 milliliters, okay? But it gives the idea a little bit better than reading it. You can kind of see and compare these, all right? So that's a good image to look at. All right. we're skipping this. This is something we would do in lab, but we're going to talk about it next week. What are spirometers? And then how do we measure vital capacity? It was something we would do in lab. I'm going to show you some images next week. You'll have an activity with that to do, but we'll talk about that since it's due the 18th. All right, moving down. This down here, I'm also going to spend time with next week since we have the time next week. This is about the chemical balance of blood pH. So what happens, and I've got a good image with this too, so we'll talk about it. But what happens for us to be able to control our pH between 7.35 to 7.45? How do we do that? How do we control it? So we will look at literally this chemical equation as it moves in one direction and then the other direction to keep the blood between that 7.35 to 7.45. So we'll talk about that next week because I've got some images and I think you guys will have some questions about it. So we're going to skip over that. All right. Now, I do want to go back to the images before I jump back to some things I want you to look at. We talk about, you know, if you guys have any questions with the exam, I do want to look at some images as opposed to everything we just talked about. So I'm going to unshare and then reshare you guys. Okay, hold on. Let's see. Here we go. All right. Back up. All right, so what I wanted to show you guys, we've got some additional images on here, such as the layers of the pleura. Okay, this is pretty much the same image, it's just highlighted. Parietal pleura, visceral pleura, here's the lungs, diaphragm, the heart. Some of these images are good to compare to for your textbook. And it's just a reminder, honestly. I will post this. I think these are really, you know, good to look at, especially this. You have the same picture that's found in your textbook, but at the same time, I'm still going to post it. We'll post it tonight, in fact. So the images I've got left are things that we've looked at. And the next week, we're going to look at the blood gas exchange related to pH. I do have an image on that at the end. But what I want you to do for the rest of this period, or you can even do it this next week if you're focused on getting your exam done, I want you to look at these images, compare, because you've got some things you have to identify. For example, here's the thyroid cartilage, tracheal cartilage, cricoid cartilage right here. Go through the images, see if you can identify everything. Here's the lungs. We talked about in one of the pictures, we talked about the left lung being different than the right lung, the left lung being a superior and inferior lobe. Here's the oblique fissure. Here is representation of the cardiac notch, which holds what structure? The heart. Here is the right lung, superior, middle, and inferior right lobe of the lung, okay? The video that we have on there too also goes through all that, which is, it's good. Definitely want to watch it. And then take yourself through the flow as you go through the nose. It's not hard stuff, but as you go through the nose and then you get to the different regions, such as the nasopharynx, oropharynx, and laryngopharynx, and then realize where you are when you're looking at these images, okay? So we're gonna go on down. And then here's the general locations images. And then compare as you go down through these images. This is one we didn't talk about. These are identification for you guys. You need to know these. For example, once again, here's the thyroid cartilage, cricoid cartilage, tracheal cartilage, be able to compare it to the bigger image. Here's inside where the larynx is, for example. This image does show something different than those. This shows the epiglottis. You do need to know about the epiglottis. You were supposed to know about that in A&P 1, what it was made up of. Talking about the elastic here cartilage, allow for it to close. The epiglottis has its function is to close during swallowing. If you're taking in food or liquids through your esophagus, this needs to close off. But how many times have you guys taken in something and accidentally water or food has gotten down into the trachea? I've done that several times. So if that happens, that means the epiglottis is not fully closed off the trachea, that tube. So now you get a little bit of water or some food or something gets in here, typically water, right? And you start coughing it up to get it back out and dump into the esophagus, right? So then I want you to be able to see, here's the vestibular fold or the false vocal cords. This is the true or vocal cords, okay? Thyroid cartilage, this is the sagittal view of the thyroid cartilage. This is the cricoid cartilage below it, sagittal view. And then tracheal cartilage, there's the sagittal view of that also. And then I would like for you to take those and compare it to this image. These are all identification that's on that, the page that you need to know as you go through the list, okay? And then, of course, I want you to be able to see the alveoli, for example. And then next week, we will look at this image. So if I go ahead and post it, this doesn't mean anything to you yet, but by next week, we're going to talk about it. I'll probably write it out. We've got it on the handout too, but I'll probably write out what each thing means, okay? So what each molecule means. And as we go through and we talk about it, we're going to talk about every little thing that happens in this image. So how in the world do we keep blood pH and take in oxygen and release carbon dioxide? I may actually add another image to this because it goes the opposite way too. So you guys have a similar image in just like this in your textbook. I don't think it's the exact same because I took this from Pearson and you guys had McGraw-Hill. So that is something I want you to see, but we will go over that. All right. Now I'm going to unshare it and reshare you for a second. Okay. Let's see. Here we go. Now, if I go back to the handout, and let's go back. These are the virtual labs. Like I said, you do not need to do these yet. So if you see them, mechanism, I'll go back to this one, mechanism of breathing. And then, of course, here's the post lab after you've done everything. So that's by the 18th, mechanism breathing. And then pulmonary function test. So that's going to talk about a spirometer to compare and to look how functional the lungs actually are, okay? So you'll go through that. Let's come back to the handout. And then if you go through the objectives, we've gone through, in general, the objectives up here, and we stopped at spirometry. And then we're going to talk about listening to the lung sounds. And then we'll talk about, of course, acid-base, the pH balance of the blood. And then once you guys finish your exam, I would jump into looking at some of this stuff. But like I said, there is a video on here. These are all the different things. We've talked about most of them. We didn't point out the uvula. The hanging ball in the back of the throat. So we didn't talk about that, but make sure that you look at all of this, even though we mentioned it already. Let me go all the way down. Of course, like I said, the serous membranes, the pleura of the lungs, you need to know those. And then there's the video that one of our instructors did that's really good. Now, she does go over every single one of these on the list here below that. So these are things we've already mentioned. Some of this, especially, I don't have a really awesome image of it, but there is the model that she goes over is the alveolar capillary network, okay? So keep in mind when you look at the alveoli or the alveolus, one of those balls, you've got a little capillary network around it. The alveoli, okay, they're all made up of squamous cells and diffuse carbon dioxide or oxygen, okay? Diffuse across that membrane of that thin layer. But it can only diffuse because there's blood supply via the alveolar capillary network, which wraps around it like a little capillary bed. So it's literally like little balls with spider webs around it, okay? And that's the capillary network that you're looking at, the spider web looking thing, okay? And typically they're colored red, okay? So she'll point that out in the video also. And then here are, of course, the virtual labs, like I said, are due the 18th and the post lab. Does anybody have any questions about this? We'll meet back next week. And does anybody have any questions about their exam, this or the exam? Nothing. Silence. Total silence. Okay.
I have a lot of studying to do, so I have a lot of questions, but I don't have anything specific that I can think of.
Okay, so do your studying because it is this week. I know you still have several days. we'll jump back into this. If you guys have more questions even about this later, you can ask me. If you have questions while you're studying, send me a text. If you don't understand something, we'll go over it together. We can do a Zoom time, whatever we need to do to discuss it. But shoot me, a text if you're confused about something, you're not sure if you should study something, for example. It may not even be that you are confused about, for example, hold on, the topic. It may be something like you were confused about, is this important for me to study for? Okay. If you have any questions towards studying for the exam, please shoot me you can text my phone. That's perfectly fine. But other than that, study. We'll finish this up next week, and then we'll go from there if you have questions about this. But other than that, I will see you guys later. I'll check on your exams this week. I'll see that they're all completed. If I harass you because I don't see something completed, just know that that could be potential if you don't get something done. But be aware that, I'm going to be watching as your exams come through. Okay. Study towards your objectives. Okay. Take the time, just like this is set up. We set up the objectives, read through them, be able to answer them. If it says to identify the anatomy physiology revealed, go through all of these, dissection tool, the anatomy physiology revealed. Even if you have to look them up real quick on your phone or a computer, make sure you're able to identify all of these and you feel comfortable with them, for example. It's the same setup. We set it up exactly the same, but they're different structures that you need to be looking at. So make sure that if you're studying, that's how you're studying. And then the activities, even the virtual labs, make sure you've at least seen the virtual lab, you know what it's talking about, because if you have a question on your exam related to that, you've at least looked at it, okay? Because that could potentially happen, all right? So be aware of that, just so we know that you've done all the activities you were supposed to do. And that shows that you get credit for that, not just doing the activity, but you've actually gone through the activity that you can answer a question about it, okay? Any questions you guys have, because I don't want to take up more of your time. All right, so I will post this video. I'll put it on there. If you guys have any questions, just shoot me a text, shoot me an email, whatever you need to do. I know they were limited. The other thing I want to say, I know there are limited slots for the proctoring exam. I don't know if Dr. Eastman has been in contact with them. I think they added more slots, but then I got an email yesterday that there was somebody still looking for a slot. So let me know if you're still looking for a slot. I need to know that, okay? Other than that, I will let you guys go. I hope you have a good evening and good luck studying and good luck on your exam.
Cool, thank you.
All right, bye guys. Bye.